Now we're just gonna be quiet for 10 seconds in case it goes on early.
Stupid. I never know when to start. Okay, I'll start now. Welcome everyone to our Facebook Live. This is our COVID update that we're going to be, well, I guess our COVID updates are typically on Tuesday nights. But today we'll probably be talking about COVID as we often are, but it's in the context of physicians running for public office and why it's so important to have doctors in elected office. And I wanted to actually start today with a recording of Michelle Au. So we have two candidates with us today. Michelle Au is a state senator from Georgia, and we have Maxine Dexter, who is in the state house in Oregon. And this is a video of Michelle giving testimony in the Senate in Georgia about public health funding. And I think it really brilliantly marries her identity as a physician and her identity as an elected official, right? And in promoting public health funding. So yeah, if we could maybe show that, great. Oh, can we not hear it?
Good thing I put subtitles on it.
Thing that's different. Ideally, public health deals with the entire population while we're still healthy. And the goal is to keep these populations well. So one of the reasons I think that public health is underappreciated is because under normal circumstances, the patients who have been helped by public health policies can't feel that they've benefited. We usually don't get food poisoning from eating in a restaurant, and that's just presumed. That's public health in action. We don't usually worry about our kids getting polio. We simply take it for granted that they won't. But that is public health in action. Every time we leave our house and don't get sick from the air we breathe, every time we buckle our kids into their car seats, every time you're not seated next to someone smoking a cigarette on a plane, that is public health in action, working exactly the way it should, which is preventatively, seamlessly, and invisibly. So the key problem with public health funding is that, especially when things are going well, that money always seems like it's paying for something that we don't really need. The same way that paying health insurance premiums when you're not sick kind of feels like a waste, right? Because why pay money when it feels like you're not getting anything? When the default assumption is health and safety, it's hard to conceptualize where that money is going. But you never realize you need that safety net until you're falling. And by the time you're already falling, it's too late to check that safety net for holes. So I implore my colleagues to consider the importance of public health, not just in this moment of crisis, but beyond it. And an investment in public health is not only more effective in avoiding injury and illness, it's also far cheaper than treating the problem itself after the fact. The same way that wearing a 50-cent face mask costs far less than a week-long hospitalization in the ICU. A penny of prevention is worth a pound of cure. And as we look to the following year and consider our public health funding, realize that the value of this investment we put in early compounds over time. Simply put, we need to invest more in our public health systems because we cannot afford not to. Thank you, Mr. President. I yield the well.
So I was just really compelled by that video the first time that I saw it. I wanted to spend a little bit of time today with each of you because the purpose of these Facebook Lives is to speak to our colleagues out there who think that they might run for public office, or maybe they know someone who think who they think may be suitable for public office, and for people to learn about really what people do in the state legislatures, in the House and in the Senate for all of our states, because I think many of us don't necessarily know what that looks like on a day-to-day basis, like why you would necessarily choose to run for a state legislative office as opposed to, for instance, local office or a federal office. Like, what is the difference really, and where can physicians make a difference and how at those different levels? So maybe each of you can do a little bit of an introduction about yourselves, since I'm not sure that everybody watching knows who you are.
So let's start. We'll just go alphabetically, I guess, since I'm like on the left side of the screen. So I'm Michelle Au. I'm an anesthesiologist in Metro Atlanta, and I'm also the new state senator for District 48, which encompasses a wide swath of North Fulton and Gwinnett counties. Usually I don't include those counties for audiences that are largely outside of Georgia, but I know that Georgia has been a little bit in the public eye, especially with respect to politics, so people might actually understand that those counties are right outside of Metro Atlanta, and it's in an area that is rapidly diversifying and rapidly turning blue, especially in this last election cycle, as we saw very satisfyingly on January 5th. So in terms of physicians running for office, I first have to say that I really understand why physicians and other medical professionals don't, right? Because the work that we do in our like day jobs, as I like to think about it, is already doing a lot of good. And it's very satisfying and it's very fulfilling to take care of patients at the bedside. And we see problems and tackle them and fix them often in the immediacy, depending on what field of medicine you're in. And that feels very good, and it keeps us very busy, right? So I don't blame other medical professionals for it not occurring to them that political action is something that they should add on to their already very busy schedules, on top of, having families and doing all the regular life stuff, because the work we do is already very meaningful and helps society a lot. I think the reason that I decided to run for office is that, a few years ago, and I won't make this too partisan, but, like November 9th, 2016, I realized as I woke up that morning that clearly, despite all the good that we do in our work, and I was at the hospital, I realized that despite all this work, clearly wasn't enough, and that I needed to do maybe a little bit more to see kind of change that I wanted to see actualized for my patients, for my kids, everything like that. And I was about 10 years out from residency, so I don't mean to discount this serendipity of timing also. I'm about 10 years out from residency. My kids were a little bit older. My youngest kid had started kindergarten. So I was at this point in my life where I felt like I could take on more. So what I decided to do at that point was actually to go back to school and to get a public health degree, because I figured, if I want to help more people and help populations and communities be healthier, public health degree, that sounds like the thing to do. And they'll, it's like a very academic thing to think, right? And we're all academicians because we went to school for 5 scrillion years. So it's like, they'll teach me what to do, and they'll teach me what's important. When you get a public health degree, what you realize is that you learn about healthcare policy, you learn about healthcare economics, healthcare law, all these things that really underlie the system in which we've been practicing for some of us, decades, right? And it's almost like you see the code behind the program and you understand why things work, and maybe more importantly, why things don't work. And you realize that the things that need to be fixed are maybe a little bit further back from where you stand next to the patient. That oftentimes by the patients get to us, it's too close to us, it's too late to fix many of the problems that made them sick in the first place. So once you realize that, you kind of realize like, the level at which these problems live is at the societal level and at the legislative level. And in tackling things at the legislative level, that's where we can make things better for our patients on an upstream level. And I can still treat patients at the bedside because I continue to practice medicine at the downstream level. So it kind of hits it on both angles. In terms of why to run for state level office, people can run for all sorts of different things. I could have run for city council. Often people point out like, your first time elected official, lots of people start smaller. Like, why didn't you run for like your school board, or why didn't you run for city council? When your interest is public health, you realize that a lot of the issues live at the state level, right? So when you are trying to craft healthcare policy and issues that affect your residents and your constituents and your patients, those are state level issues. Healthcare policy is crafted in the state legislature. So, it's like that old joke with, who was that bank robber? Like, I can't remember his name, but he's the guy that they asked, like, why do you rob banks? And he said, well, that's where the money is, right? Why does a doctor want to go work in the state legislature? Because that's where the work is that we want to do. So that's part of it. Everyone has a different reason for why they run. Everyone has a different focus for the work they want to do. That was mine. And I suspect that many other people who are focused on healthcare policy have these similar concerns. So I'm happy to talk more about that. I don't want to take up too much time, but that's sort of my story in brief. And like I said, I just got here, right? Like we started session on January 11th. We just finished our 6th day of session because it's a little bit spread out, especially in the beginning of the year. But already I'm trying to at least push this sort of specialized agenda that I have, which is focused on healthcare policy and public health, especially because right now we're working on finalizing our budget for next year and really trying to push the fact that our public health departments need more help, especially in this moment that we're asking them to move mountains and we're not giving them the help they need. So that's sort of where we can contribute, is having that perspective. But I'd love to hear from Dr. Dexter and hear what she has to say from all the way over there.
Yeah, we're covering both sides of the country here. So yeah, I'm Dr. Maxine Dexter. I'm a pulmonary and critical care physician in Portland, Oregon. Trained in Seattle, Washington, where I grew up in a working class family, first and only person still on either side to go to college. None of my nieces, nephews, siblings, very working class family. And growing up, education was the only opportunity that I saw to actually doing something interesting. My family's truck drivers and different things, and I just wanted something different. So number one, as far as, why public policy and running for office, I knew from a small child that I was going to run for office someday because I had to work so hard to get where I wanted to go, and my family was really struggling, and I didn't feel like that was okay. So I was an undergrad at the University of Washington and knew I was going to go to medical school because I also wanted to be a doctor when I grew up. So I did political science and editorial journalism as my undergrad degrees, and medical school couldn't figure out why I was doing those things. And it was really because I was going to do health policy, and I knew I was going to do a master's in public health and do all these things. And so what has happened is a 30-year strategic plan that has finally come to fruition. It's really quite, remarkable. It's an American sort of phenomenon, I think, that you can kind of jot a position as a white person, which is clearly one of the major things that we need to address is if I were Black or brown, this wouldn't have happened. And so that is the second reason why state policy is we really have to understand what other people are going through to be able to make policy to address it. And we have white people of privilege overwhelmingly in our state legislatures. That is changing. We have the most diverse class ever this year in our state house. But without those perspectives, we aren't going to change the policy that impacts lives. And so that's the second reason for the state. I'm a mom, so why not federal? I've got 2 teenagers and had no interest in trying to move my family nor my career. I mean, I'm a pragmatic sort of person. I've got my license, I practice medicine, I've got a great group that I've spent 13 years cultivating my panel of patients and didn't want to leave. So didn't even think about federal office, and exactly to Dr. and Senator Doctor, I've learned the right order, Al, that, and I had the reason in my head, and then I got distracted thinking about what I was actually saying, Senator Doctor. So anyway, I can't remember what that point was. So I'm not going to end on that. So healthcare policy is what I'm doing. We are, I have a bill that it's getting a lot of traction to do global-based payments for our state commercial market. And what that really does is align our payment structure with our values and outcomes. And so paying to keep people healthy rather than for services. And we've seen an 80% drop in our fee-for-service reimbursements to our hospitals this year. So it's not a resilient nor a stable system based on fee-for-service. So I think it's now with COVID, it's a major opportunity to kind of show why we have to have policy reform. And then because I'm the only doctor in the House, I am the chair of our COVID-19 subcommittee. So I am, really in the thick of all of it with vaccinations and trying to implement a strategic plan that is really hard when there's no federal leadership in this area, as I'm sure many of us are living every day. So I was running before COVID ever came on the scene. I was appointed to this position in May, and COVID had clearly already I'd been taking care of patients in our ICU then. So it's really just this ironic and tragic sort of trajectory from thinking I was just going to do health policy to, trying to help my state through this tragedy. So it's really a privilege to be in this position, and the impact that you can have as a physician in policymaking seats is incredible. I just as an example, sorry, I won't talk too long, but we were talking on Judiciary Committee today and earlier this week about bills that clearly nobody understood the impacts. Somebody said, you'll let someone out of prison if they have a terminal illness. And I said, what's the intent here? Because that can be years that people can live with a terminal diagnosis. Are we talking about hospice? Are we talking about, so being able to ask those questions, and then another, statute with a mandatory sentence of 300 months for permanent cognitive disability. And, I was like, wow, that is such I have a hard time deciding on disability for something like that, let alone a 300-month minimum sentence for someone who commits a crime that causes that. So already I'm seeing the importance of just having that perspective. So really, I strongly encourage people to consider it, and it's a joy.
That's amazing. I think that I could just sit here and listen to the both of you and just say nothing whatsoever. But we have a small amount of time. I don't want to ignore that there are questions coming from the audience. So before I ask any of my own questions, I'd like to ask this one here. And that is, in what ways was being a physician on the campaign trail an asset for you? In what ways was it a liability? And were you attacked about COVID shutdowns being a legislator who is also a physician? Or were you respected, revered for your frontline work?
I'll say one thing about being a physician running for politics is that we're in an age where people have a lot of distrust and division, partisanship over politics. So people, maybe even more than ever, don't necessarily trust politicians. However, people still trust doctors, they trust nurses, they trust medical professionals still. Maybe even more so now because of the age we're living in, and that COVID has highlighted a lot of these reasons that we need to turn to experts in science and health policy and these types of things. In some ways, maybe it was a liability. I don't think that the assets were less than the liabilities. Obviously, we run against people. Our opponents are going to try to find ways to turn your strengths into weaknesses. So, not everyone loves doctors, right? I ran against a lawyer, right? So it's almost like the fox and the hound, right? Two natural enemies coming against each other. So, just to point it out in case other doctors decide to run, this is going to come up, that people will always, note that maybe doctors are representing their own interests. I was accused of wanting to line my own pockets. I was accused of, I'm running as a Democrat, right? So it's a little bit hard to make this argument when I'm making an argument for expanding healthcare access and Medicaid expansion and these types of things. But people can say whatever they want, right? So I think that the types of criticisms that are levied against doctors, that they are trying to protect their own practices, trying to protect their own pocketbooks. My opponent ran a series of ads that said, why would you elect her? She's going to be a fox in the hen house trying to protect her own bottom line. People are going to say things. you don't have to pay attention to them. You know why you're doing it. You understand the goals that you're trying to fulfill. I think people often become wrapped up in that sort of negative campaigning because we're not used to it. Like, I think doctors especially are committed to the purpose and the nobility of the work we're trying to do. So we're not used to people not understanding why that work is important, and we get very offended, especially when it's clearly not a good faith argument. But there's no need to give the surgical fire more oxygen, right? You don't need to pay attention to it. People can see who you are from the type of work you do. And I think that's a tactic I took. I think it did work. But for other doctors who do want to run for office, and I encourage people to do this because we have a font of expertise that's very meaningful and very useful in this moment, to not be surprised if people say things that offend you, because that's not who we are, but people can say whatever they want. In terms of the COVID environment that we ran in, it's also a blessing and a curse. I think obviously COVID highlights the importance of public health. It emphasizes the work we're trying to do, especially as, not to be partisan, but as Democratic legislators, to be focused on healthcare access, healthcare equity specifically, is something that COVID has uncovered specifically. But there will always be that tension between public health and the business side of things, that people will accuse us of trying to squelch business interests, that we are preventing kids from going back to school, that we are preventing businesses from operating fully. So we just have to really think through our reasons for making the arguments we do, and just like anything at work, to refer back to the science and say, like, look, I know this is hard. Just like when you talk to a patient, and I try not to minimize people's concerns. I'm like, look, I understand this is hard. I have kids too. I don't like this either. I don't want this. However, the reasons that we're doing this are A, B, and C. We have to weigh risks and benefits. And it's really that ability to balance the different concerns is a skill that I think physicians and medical professionals specifically have, because this is what we're trained to do, is have hard conversations and not minimize people's concerns, but to try to give sort of guided, reasoning to help people towards the best decisions for not just our concerns, but everyone's concerns. So that's where I am. I'd love to hear what everyone else has to say.
I'll just jump in really quickly. I found being a physician was more an asset than a drawback, for sure. We knock on doors, or those of us who do clinic work every day, and establish pretty quickly trust with a stranger. Back when we saw people in person, our whole career has trained us to be able to see past partisan issues and being able to understand where people are coming from, and find our aligned mission and work towards that regardless of our differences of opinion. And really, it's finding that understanding that I have found really helpful for establishing trust with my Republican colleagues, and being able to see past sometimes the anger, the frustration that people are expressing, and really be able to articulate exactly to Senator Dr. Rao's point, that you can articulate what it is that's behind the emotion, and then be able to move forward with the negotiation in this regard, but the visit. So I had no issues. We were canvassing when I first started running for office, and so it was really easy to knock on strangers' doors and start talking to them. Harder about yourself, easier about them. Being attacked over COVID, I haven't had that at all with the shutdowns. In fact, I think people have taken reassurance in the medical provider who's taking care of patients in the ICU and seeing their dying days, and having them separated from their families, and doing Zoom, last minute interviews so that they can say goodbye. Like, I think that really brought home that a sense of gratitude that I was there. There's a lot of folks who expect me to be able to side with them, especially right now we're struggling over opening schools and whether or not that's the right answer. And I also believe that the data-driven nature of medicine and being able to assess what's good data and what's bad data is really helpful, because there's so much bad data out there right now. And so it helps my colleagues to be able to say, no, those things are nonsense. This is peer-reviewed data. This is what we can put our money on. That other, that's not something that we should be listening to, and we need to focus. So I've found it to be reassuring to my colleagues as well in the House. Revered, I don't feel like I've been revered, but certainly increased leverage and influence because of it. And, a freshman getting a gavel as a committee chair is really unusual. So having that COVID committee chairmanship with a really highly visible topic, I think that was just a measure of the respect that being a physician has. So, and we had a prior physician who was in the Senate who was amazingly impactful, and Governor Kitzhaber was a physician, or is a physician, who was our really fundamentally influential physician governor. So we have a history of this in Oregon, and people tend to like the health policy that comes from us. So I definitely am standing on the shoulders of others here.
It's so amazing to hear that. It's also so interesting because we do have physicians in the Texas state legislature. I don't know that I would describe that experience as amazing.
There is the tort. People just assume that I'm going to be on the side of the malpractice, anti-malpractice, the doctor-lawyer thing. I was in a competitive primary, and it was a doctor, lawyer, a teacher, and a Salem insider. It was like a really bad joke. So it ended up being, the doctor versus the lawyer a lot, which is really not helpful.
Right. So we have one more question here. Given how almost all economic and social policy intersects with public health, how do you decide what to prioritize with the platform that you have?
I think that you just have to check on bandwidth. Sorry, I totally just jumped in there, but we have been talking about a lot of policy, and COVID is, now that I'm chairing this committee, is really prioritized that. Like, I really need to focus on that. And then I set one policy agenda, which is healthcare reimbursement reform. And then I have lots of environmental and clean air bills, and we have just basically put them in order of most important to least, and they're all important to me. And yet you can only accomplish so much. So if I get a successful committee through and my policy through for freshmen, I'll be pretty happy. But I think we've got a lot of opportunities with those other ones in building alliances and coalitions. The really interesting thing is the lobbyists do a lot of the work for you, and lobbyists have a really bad name, but honestly, like, these are folks who have spent their life in some areas advocating for policy and are thrilled to have someone who will put that policy forward, and they'll help carry it. So it's finding those allies who care about the same things and then having them help you get it through.
I think the blessing and the curse of a public health background is that you realize that everything relates to public health, right? We talked about the social determinants of health. And when you look at them, there's nothing in that list that is not a legislative priority, right? Because it's not just like access to health insurance and like drug pricing, which are like classically medical issues that we think about, but it's everything, right? It's public safety, education, economic opportunity, public safety, racial equity, all these things. So really, when you think about what you care about and what's a public health issue, it's almost like when you're in med school and you're like first year, you're reading the textbook and you're highlighting the things and you end up highlighting the whole page, right? Because if everything's highlighted, then nothing's highlighted, right? So at some point you have to think like, of these public health issues, what is my thing, right? Because I can't speak as intelligently to every issue, and I don't have the same level of expertise and commitment to every issue, even if they are important to me, right? So you just have to see, like, where is my heart the most? Where's the most skin in the game? So like for me, like I chose like, obviously COVID response is everyone's top of list, right? Because how could it not be? Healthcare access is the top of my list. Education is the top of my list. And that's just like for like a regular person reason. Like I have school age kids. They're all in public school. Obviously I have skin in the game, so I can't help but to care about that more. But that helps my constituents too, right? Having skin in the game makes you really devoted to those types of issues. And you want to be the most useful as possible, right? Maybe I'm less useful in other areas because I just don't know them as well. You can't know everything. It's just like at a hospital. Not everyone's a cardiologist. Not everyone is a generalist, right? Like we have to have different areas of expertise, and that's how we operate better, that we have people who are focused on certain issues. And it's, the legislature is like building a Voltron, right? Like everyone has their own special thing, and you try to choose the things that are the most useful to everyone and do those the best that you can.
Yeah, the comment I want to make here is that I think it is so important for, all of our governing bodies at every level, including the state legislatures, to be representative. And I think it's important for democracy to be participatory because, we have a diversity of people in our citizenry, I guess, people who are documented and undocumented. I don't want to use citizenship in that way, but everybody who lives in this country. And then I think ideally we'd have a representative government that reflects that diversity. And I think what is so important about that is exactly what you've said here, which is that we have to prioritize, right? And typically what we will do is we will prioritize the things that we are most familiar with, right? Or we are most passionate about for whatever reason that may be. And so then I think it is important for people coming from all walks of life with all different kinds of experiences to be represented, because that's how ultimately you have something that reflects the interests of everyone, right? So I think it's amazing that you guys are doing what you're doing in your respective state legislatures. I have this dream that we will have the equivalent in physician women, people of color who are physicians in state legislatures across the country that rivals ALEC, which is like the American Legislative Exchange Council, so that we can all collaborate on things that work in our communities that actually bring more equity into our communities at every level, and justice, right, for all. Which is, I think, the counterpoint to ALEC, quite frankly. So I think it's great that you guys are where you are. And I hope that we have physicians who will be inspired to run for state legislatures across the country, as you guys have in your states, and can learn from you. That's one of the things that Doctors in Politics is doing. And I'll close with this, is that we think it's really important to grow our community of physicians who are serving the public in this way, because we don't have that right now, right? Because we have so few people who think like we do, who are physicians in public office. We don't have a community to lean on. And so I think that's really crucial, actually, for us to make change ultimately that's sustainable and impactful. So anyway, thank you guys so much. And we'll talk to you soon, I'm sure, in some capacity. Thank you, guys.
Thank you.
Bye-bye. Texas is next.
Yes.
Next on the list, right?
Exactly.